And now it's time here at Freedom 106.5 FM with our special health segment featuring Dr. Jason Batson of Batson and Associates. It's time to talk health with Dr. Jason Batson. He's a senior medical consultant at Batson and Associates, and here we'll learn all about their natural and integrated services and programs. We will remind you to make note of our number 627-3223, 627-3223, and 625-2257, 625-2257, where you also get the opportunity to connect with Dr. Batson here at our studio. Dr. Batson, good afternoon and welcome.
Hi, good afternoon. How are you doing?
It's great to have you back with us.
Thank you very much. So today, a pleasant good afternoon to the listeners of Freedom 106.5 FM. As usual, we're discussing health. Last week, we had a very interesting discussion where we touched on a number of topics. We spoke a bit on diabetes. We spoke on arthritis as well, too. We had gotten some information there. And today, one of the things we're going to discuss is acid reflux. A lot of persons complain about problems with their stomach, whether if it's not acid reflux, it's bloating. If it's not bloating, it's gas. So we're going to touch a bit on those today. So we're going to find out exactly what is acid reflux, who are more susceptible to having acid reflux, what are some of the things that causes it, what are some of the symptoms, and of course, what you could do from a lifestyle perspective, and by extension, perspective of natural and integrated medicine to really address that situation. Let me just remind our listeners that we are live on our social media platforms. So we are Batson and Associates Limited on Facebook, on Instagram, we are Batson and Associates TT, and on YouTube, we are Batson and Associates Trinidad. Okay, and those telephone numbers again and location, you can get us on 222-8261. That's 222-8261. So if you have any questions or you need any further information as regards to what we're discussing, products and services available at Batson and Associates, that's the number to get us on. And you can also call DB telephone number as well. That number is 223-7515. Again, that's 223-7515. And those locations are either Chagonas, Montrose Main Road. Debe is the corner of Ramsey Trace and the SS Erin Main Road in Debe. St. James is Red Edge Mall, Western Main Road, St. James, and Tobago is the Triangle Building in Scarborough, Tobago. So again, we're discussing acid reflux and issues associated with the gastrointestinal system. However, your questions could be multifaceted in terms of any issue that you may have or any questions regarding the products and services of Batson and Associates. So, acid reflux. You would often hear a lot of persons sometimes complain that they have acid reflux, they are burning. Some persons may eat and they feel as if it is their food wants to come back up. Some persons' situations may be so bad that long hours after they have eaten, they can't even lie properly to sleep. You have to get like maybe 3-4 pillows to sleep on. So they have to actually sleep in a sitting position for fear that this acid is going to regurgitate and come back up in their throat and cause all these type of problems. So it's normally diagnosed or medically termed GERD, which is gastrointestinal reflux disease. Now, with that, what usually happens to a number of persons, you could have acid reflux for a number of reasons. A common reason is something known as a hiatus hernia. And a hiatus hernia is just simply where, based on anatomy and physiology, your esophagus, which is before your stomach going down, there's a door that is supposed to close there called the esophagus sphincter. And that door is supposed to close off and basically close off the stomach from the esophagus. But what happens to some persons, because of that hiatus hernia, you may have a strain and the door doesn't close properly. That esophagus sphincter doesn't close down and it remains partially open. And as a result of that, you find that acid could now regurgitate from the stomach and come up into the esophagus and cause this problem with excess bloating, belching, burping a lot, passing plenty gas, or in some instances, severe stomach pains, chest pains. If someone has ever experienced an acid reflux episode, it's not one of the best, you will end up in the hospital. because it feels so bad. I mean, I have never had it, thank God, but based on explanation and just understanding how it affects the body, you get severe burning. In some cases, it actually feels or appear to be a heart attack. Most of the times, medical professionals would run blood tests to make sure it's not a heart attack that you actually had, and only to realize that you have now, or you are now diagnosed with acid reflux or gastrointestinal reflux disease. So those are some of the things that you could look for to determine if you really have acid reflux. But as I said, if you have unusual bloating, you always feel full, you have situations where you passing a lot of gas, that again could be early indications of gastrointestinal problems. So that's something that persons need to be wary of, pay attention to where that is concerned. As I said, we are live on Facebook. There's actually a question someone is asking on Facebook here. One of the questions they're asking is, if you are diagnosed with acid reflux, what are some of the things that you can do to address that naturally? The thing is, usually, you would have a medical examination performed. Usually, they do something known as an endoscopy, and that's where they will take a tube and they would insert it and put it down your throat. In some cases, camera guided, so they will be able to determine if you have any ulcers as well inside of there. Or you could do something known as a colonoscopy, which is basically the reverse. And that camera is basically go up into the intestines, and they would look to determine if you have any issues associated with polyps, if you have any what is known as inflammatory bowel conditions, so things like ulcerative colitis, Crohn's, irritable bowel syndrome, that type of thing. For the layman listening, as I said, I'm not telling you to go and self-diagnose yourself, but there are certain things that you need to be wary of. As I mentioned before, if you have frequent bloating, having a lot of gas is not a good sign. It is usually a sign that you are doing something wrong. So something in your lifestyle needs to be corrected. Most likely it could be dietary or practices. A perfect example is some people eat and drink simultaneously, and that's one of the worst things that you can do, because that's the reason why you have teeth. You're really supposed to chew your food properly and, swallow, and you don't really have to eat and drink simultaneously. That really interferes and prevents proper digestion. Apart from that, the use of some medications could also contribute to it as well. If you see issues with blood in your stool, that could also be a red flag as regards to issues with the gastrointestinal system. So it's just a matter of actually paying attention to yourselves. I always tell persons, you are your first doctor before any doctor can address you or deal with you, because you have to be able to identify changes in your body when you're not feeling well, and when things are a bit off, and at least try and deal with them immediately and not wait until they get really bad. So let me just give you those telephone numbers. Again, I'll allow you to just remind the listeners as to what telephone numbers they can call or what WhatsApp they can use there to actually send their questions to us.
And our hotline numbers are 627-3223, 627-3223, and 625-2257, 625-2257. Also, our WhatsApp, 306-1065, 306-1065. We encourage you to use those numbers and the WhatsApp to send your medical queries straight to Dr. Batson, and he will answer them for you right here at Freedom 106.5 FM.
Good. And in addition to that, if you need any information as regards to our offices, as I said, those telephone numbers, again, you can utilize 222-8261. That's 222-8261. That is for the location on Montrose Main Road in Chaguanas. And Debe is the corner of Ramsamooch Trace and the SS Erie Main Road. That telephone number is 223. That's 223-7515. Or 341-4813, 341-4813. And you can get all the information that you need to get regarding that particular situation. One of the things too as well, you hear a lot of persons complaining of, is that situation of bloating. In some cases, they may have stomach cramps. Usually, if you have any gastrointestinal issues, they are usually manifested, as I mentioned, in those particular symptomologies or things that you may experience. So bloating, gas, persistent, frequent belching, that's always an indication that something is not right. Your food is not digesting properly. And the unfortunate thing is there are a lot of persons out there who we eat, or you may eat. Some people have very expensive vitamins that they buy, which nothing is wrong with that, and supplements. But the thing is, you cannot derive maximum benefit from them because the digestion or the assimilation is not as it should be. So in instances where you're supposed to be getting maybe 80% of what you may be consuming in terms of whether it's vitamins, minerals, enzymes, whatever, you're actually getting much less because that assimilation situation is not as it should be. So that's something that you need to pay very, very close attention to. One of the things as well too, I see Miss Jennifer Valentine. Let me say a good evening to our Facebook listeners, Miss Carol Rochester, Miss Regina Murray. Miss Regina Murray is asking what issues or how can someone know that if they have a stomach ulcers? That's actually a very good question. When it relates to stomach ulcers, one of the things that you have to understand, usually in most cases, if you have a stomach ulcer, you would get pain. However, that doesn't necessarily have to be the case because most of the time you would get pain when it has already become very chronic. So you might find some instances where you're getting burning in the abdominal area. You might find in some instances when you eat, you get slight discomfort, slight pain. All those, as I said, are indications that something is wrong there. And then it may mean that you need to go and see a gastroenterologist, where they would now recommend whether you do or have an endoscopy done. In some cases, a colonoscopy. One of the things we do at Batson Associates is something known as dark field microscopy or live blood analysis. And as I was highlighting last week, one of the things that gives us the opportunity to understand, it gives us an in-depth look at how your blood behaves and how it behaves in terms of blood is supposed to look a particular way. The red blood cells are supposed to be of a particular size. They're supposed to be separated in a particular way as well, so they're not supposed to be sticking together. When we see what is known as erythrocyte aggregation, erythrocytes are red blood cells. Aggregate means that they stick or they aggregate together or stick together. And usually that's an indication of poor circulation, one. It is also an indication of poor oxygenation. And as regards to the discussion that we're having, it is also an indication of malabsorption. So it simply means that your food is not being assimilated or absorbed properly. So that's something that you need to pay close attention to. And as I said at Batson Associates, we can actually address that situation for you, from a natural and integrated perspective. Now, what does that mean? Now, usually, if it is you are diagnosed with acid reflux, GERD, any of those issues, you normally be recommended acid blockers. So you have things like Nexium, Pantecta, Omeprazole, Omes, and all those basically have the same mechanism of action in terms of blocking acid or lowering the production of stomach acid. Now, that may help to an extent, but the issue a lot of the time sometimes is not necessarily too much acid, but in some cases not enough acid. Because we know as it relates to digestion, one of the things that your body does, it produces hydrochloric acid, which has a pH of about 2. So that's highly acidic. The thing is, you cannot store hydrochloric acid, obviously, because you'd have a hole in your stomach. You would not exist. But that acid has to be produced at a particular time in order to facilitate specific digestion of proteins when you consume meat, that type of thing. The point is, you want to now correct or bring back balance, equilibrium to the intestinal area, the intestinal tract. So what are some of the things that you need to do? One, hydration is very important. And last week I did touch on that as it relates to water, because a lot of persons just do not hydrate their body properly. And hydration is fundamentally vital for proper digestion, because if you are dehydrated, your body actually takes water from your colon first. So it would pull water from the intestines, and then after that, it would actually start to take water from the stool, which could actually cause you to be constipated. That's why they usually recommend, if you have constipation problems, one of the first things you should do, apart from looking at your fiber intake, is actually look at your water intake, because that's usually where the body would go when it's dehydrated. So that's one of the first things that you need to pay close attention to. One of the other things, as well, as I said, is some of the practices that you have. So you're not supposed to eat and drink simultaneously. That is not a good habit. Another problem, or something that persons rather need to pay close attention to, is consuming other beverages while you eat. So it's bad enough to drink water while you're eating, but it's even worse to consume things like juice and soft drinks and that type of thing. That's a very bad combination. It seriously dissolves your gastric juices, because what your body does is that from the time you start to chew, your body automatically, in fact, digestion begins with your eyes. So from the time you see the food, you already start to salivate, and your body is knowing that it's getting food, and as a result of that, digestive juices begin to be produced and whatnot. So the thing is, your body is already prepared to start to digest the food properly. So when you actually go and drink, especially cold beverages, you actually impede or slow down that normal digestive function, and it makes it more difficult for your body to digest food. It also makes it very easy for you to get a very big belly, because there are a lot of persons sometimes, they're trying to lose weight, and that's both male and female, and they don't understand why the stomach not going down. That is actually one of the reasons. So that is something that you could actually utilize to help lose belly fat, especially because that's where the problem area usually lies for persons. At Batson & Associates, there's a product that we carry called Digestive Restore, and that product is primarily designed, you have prebiotics, probiotics, and digestive enzymes, and what it actually does is actually help in breaking down the food properly, and it also helps the body in the production of enzymes. It also helps as well in terms of bringing back that balance in the the small intestines as it relates to the healthy bacteria. So that's very important, and it's something that you could actually look at in improving that situation. There's also a product that we carry called gastro tea, or a gastrointestinal tea. So the tea, which you would make like a normal cup of tea, you take a tea bag, you steep it in like about 8 to 10 ounces of water. And what you do is you basically consume it as hot as you can, not enough to burn your mouth, but warm. And that in itself actually helps with improving digestion. So that's something that you could look at, and you could always check us out. As I said, those numbers again, you can give us a call on 222-8261. That's 222-8261, as well as 223-7515. Again, that's 223-7515. And of course, the office will be able to give you the necessary information regarding that. Do we have any questions as yet, or is everybody being very shy today?
No, actually, we have a WhatsApp message that reads, someone is asking, what are the best vitamins for someone at the age of 59?
Best vitamins for someone at the age of 59. But the thing is, ideally, okay, I'll cover a broad spectrum, because ideally I would need more information in terms of activity, that type of thing. Vitamin requirements are always dependent on the individual that is using the vitamin. So you will hear persons say, okay, so let me give you an example. Let's say you are, what age the person said? 59?
59, and it's a female.
Female, good. So if there's a 59-year-old who's very active, so they would do the little exercise, they may be walking, or they may be somebody attending the gym, then you'll need a little more than the regular individual. So you're going to have to get a multivitamin. That's one, which would normally cover your Bs. You'll have some C in there, you'll have some minerals as well. So things like magnesium, zinc, chromium, copper, that type of things. I'm very brand specific, obviously, for the number of years I've been doing this. There are some brands I do use, period. There's one that we carry at Batson & Associates, which is, we have male and female. And in that, you would get things like your omegas, you will get your mineral breakdown, so your selenium, zinc, chromium, copper, manganese, potassium, those type of things. You'll have your B, so you normally get things like B3, B6, at least a B12. So that's something I would recommend. I'm a big advocate of silver, the mineral silver. A lot of persons are not aware that silver is one of the most potent natural antibiotics. So much so that it actually helps to boost the immune system. So that's something that you could always add to your regime, and that is something that we carry at Batson & Associates in the form of mineral formula, which is silver with other minerals. Silver is so potent that is actually used in Western medicine, where if a female actually gives birth, let's say she has an STI, so she has some sort of things, chlamydia or something like that. The thing is, if she gives birth normally, what you find is that within a matter of minutes, that child will eventually end up blind because of whatever the viral or bacterial infection is, depending on what STI it is. What they would normally do is actually give silver eye drops to the baby as soon as the baby is born. And that is actually protocol in a lot of hospitals all over the world, because what it does, it doesn't damage tissue and it doesn't damage probiotics in the body. So that is something, as I said, you could actually put into your regime and you will see some benefits where that is concerned. Additionally, I would recommend some form of vitamin C. We know vitamin C is primarily ascorbic acid. You're looking at anywhere between about 2,000 milligrams per day. But again, it depends on if that individual may have other things to take into consideration. Like if it is, they may have things like diabetes, hypertension, that type of thing. But that is basically a general recommendation that most persons that age would, they would be safe to follow those where that is concerned.
Okay. We are speaking with Dr. Jason Batson here at Freedom 106.5 FM. His company, Batson and Associates, started its operations in September 2009. It is an organization of trained health consultants and practitioners in Ayurvedic, Chinese, holistic, natural, and nutritional medicine. And if you have a question you would like to ask him, feel free to call us at 627-3223, 627-3223, or 625-2257, 625-2257. A follow-up to that question, Dr. Batson, is that the lady says, what is the best way to treat going through menopause?
Okay, that's a golden question there, boy. The thing is, as it relates to menopause, women need to be very careful. Well, first of all, you have 3 phases of menopause. You have premenopause, or what's known as premenopause, menopause, and postmenopause. Now, you'll hear people refer to perimenopause, which basically would be before. Why I say you need to pay very close attention to when females go through menopause, it can be a very calming experience in some cases, but in most cases, it could be a very turbulent experience. So you would have issues associated with insomnia, elevation in blood pressure, in some cases anxiety, in some cases severe depression, severe muscle weakness. Some women go through issues where their thyroid starts to give a lot of problems during that time, where they would actually discover that they now have thyroid nodules, or they would discover that they have hypothyroidism, which is low thyroid function, or hyperthyroidism, which is high thyroid function. And in both instances, that's very dangerous, because if you have hyper or high thyroid function, you can have problems with losing a lot of weight. You have serious insomnia problems. You have metabolic issues where you feel like your heart is just starting to race off. If you have low thyroid or hypothyroidism as a result of menopause, you can now go into situations where you put on a lot of weight. You have decreased heart rate. So your heart rate could go from maybe about 67, 70 beats per minute to drop into 40, 45 beats per minute. So those are some of the symptomology that you can experience. In terms of treating it, of course, from a holistic perspective, you need to give the body what the body has now lost. Now, what is disadvantageous to some women is sometimes the more children that you have had, the worse, the situation for your menopause could be. Because, after pregnancy, women tend to lose a lot of minerals. You lose calcium, magnesium in large amounts. Some women after pregnancy, they can actually lose teeth. They have serious problems with their bones, bad problems with their eyes. And that's because you lose so much minerals during that time. And then you add, let's say you have 4 children and then you're going through menopause. That could be even worse. One of the things that they will have to do, or what we would do at Batson Associates, I would do the blood analysis and the magnetic resonance scan. First of all, to determine the levels of the hormones, so things like estrogen, progesterone, and those type of things. And once we establish where those are, we would now supplement and put together a protocol where we would now put certain things in place. What I would say is that it is a very turbulent and distressing situation. I've dealt with some very, very serious cases. There was in fact a client that I dealt with who when she started going through menopause, maybe about 2 years after, all of a sudden she started having elevated blood pressure. And she didn't know why, because she went to the doctors and the doctor told her, well, okay, you have high blood pressure now. And she said, well, I don't do anything that would warrant me getting high blood pressure. I eat pretty well, I exercise. She stays away from table salt. So the diet was really a clean diet when I looked at everything. But when we did the examination, Ms. Randan and Mr. Bustamante, and I saw the results, one of the things that we were actually able to pick up is that they had serious deficiency in a lot of minerals as a result of going through the menopause. And apart from that, there was a serious nerve damage, because that's one of the problems that a lot of women experience, whether it's premenopause, menopause, or postmenopause especially, where they have serious issues where they could actually have mental breakdowns. I've seen a lot of persons with it. I've dealt with a lot of persons with it. And the reason for that is that the body does not have sufficient neurotransmitters to actually address all that stress and hormonal balance, or imbalance rather, in the body. So I'm saying all of that to say that you would need to, I would look at building the body. So there's a product, for example, we carry called Optimizer, which is actually a free radical scavenger. And what that does is actually help in boosting the endocrine system, which in turn helps to balance the hormones. And you find that they start to do better in that light. Depending on the individual, then more would have to be recommended where that is concerned. Okay?
And if you would like to get in contact with Dr. Jason Batson and visit him, you can do so at the first floor, Money Talks Building, 182 Southern Main Road, Montrose. The number there to call is 222-8261. 222-8261. But if you would like to speak to him right now, you can do so by calling us at 627-3223, 627-3223, or 625-2257, 625-2257. You can also send us a WhatsApp to the number 306-1065, 306-1065. Dr. Batson?
Yes. One of the questions too we got on our Facebook. So as I said, keep in mind you could add us on Facebook, on Instagram. On Facebook, we are Batson and Associates Limited. On Instagram, we are Batson and Associates TT. And on YouTube, we are Batson and Associates Trinidad. So we're getting a question here from Miss Gina Awau, and she's asking the questions. As regards to menopause, could someone experience these symptoms long after menopause has finished? And the answer is yes, because you find, I'll give an example. Let's say a female would go through menopause, let's say 45, some cases 50. Persons have to understand that menopause doesn't necessarily have to do with age, but it has to do with the amount of egg reserves that a female would have, and that is different for different women. So there are some women who could go through menopause very early. In some cases, I've seen 35, and very late, I've seen 65. So, it depends. The thing is, someone could go through menopause at the age of 40, and they end up with postmenopausal syndrome, insomnia, serious problems with anxiety, depression, hypertension, thyroid problems, and they start experiencing that at the age of 60. But keep in mind, they went through menopause 40, 45. So you're talking about 20 years subsequent. So a lot of people find that weird, how is that, how can that happen? And the reason for that, is that you have to understand that once you are alive, once you're breathing, once you draw breath, it means that your body is working, it is functioning, and it would always be in need of maintenance, in need of repair, as it relates to one supplementation diet and that type of thing. So it's always a matter of just adjusting. And there is a lot of help that women could get with that, because I have dealt with a lot of females who have had postmenopausal issue, and it's not a nice experience. I remember dealing with someone in Tobago, and the experience was so bad that this lady, she literally used to go, her panic attacks would be so bad that she would be cooking, and all of a sudden they would hear noise in the kitchen, like things falling down. She would get so weak that she would just fall down on the ground. And that happened to her for like maybe about 2 years before actually coming to us. And after we dealt with her like for about 3 months, the problem was corrected, and she has never gotten it. And that has been a client of mine for like about 4 years now. So, I'm just saying that to help persons to understand that you need to really pay attention. And if it is, you're nearing that time, or you're feeling, for example, you're seeing that your menstrual cycle is stopping, because in order for you to know you have gone through menopause, you're supposed to have consecutively not seen your menstrual cycle for 2 years. Now, there are different things that you would have to take into consideration. If you would have done chemotherapy and radiation, well, then that's something different, because that could actually stop your period altogether. If it is you have hormonal imbalance challenges, so you would have had in the past things like polycystic ovaries, fibroids, ovarian cysts, endometriosis, those type of things, and you are custom skipping periods, well, then you need to pay attention to that as well, because the possibility exists that you may not necessarily be going through menopause, but you just have irregular menstrual cycle, because there are some women who can miss a menstrual cycle for a year, and then the period will come back subsequent to that. But that is an instance of serious hormonal imbalance. So again, it's a matter of discussing it with your primary care physician or practitioner. And of course, what Batson Associates basically offer is not necessarily alternative per se, but an integrative approach where we basically marry the Western together with the integrated medicine, especially in the aspect of dietetics and nutrition and that kind of thing, which is very important. So that's something, again, as I said, that you need to pay very close attention to. And feel free to give us a call or visit. We also have deliveries available. I know some clients were asking about that on this frequency. So that is something that we have started back. And you can always call any of the numbers that was mentioned there, 222-8261, or the 223-7515, and you can get information regarding that road delivery as well.
Dr. Batson, we have a caller with us. Hello and welcome to Freedom.
Yes. Yes, Mr. Batson.
Yes, sir. How are you?
You remember? Nice program. I catch somebody on the radio. You ever hear somebody used to call it the name Point Blank?
Of course. There's yeah, I know who this is. How are you doing, sir?
Point Blank, I call it because you know why?
Why is that?
You give it up. I was out for a good while.
Okay.
I got to see that here back on the air.
Yes, ma'am. Yes. I was on a little sabbatical.
Yeah. I was on sabbatical.
Okay, I hear you.
It was an accident.
Oh,
I had
okay.
surgery.
Whoa.
I had to head on back 5 times.
Oh, okay.
So I sit down home here and I get to the radio and hear you. I hear this morning on some other program.
Oh, yes.
After 1 or 2 here. So I hear it. But don't worry, when I need it, I'll call you and come down later.
Okay, good. No problem. Yeah, I remember, man. Yes, man. But when you're ready, you give me a check or you could call and we'll organize the suit. I said, when you're ready, you could give me a call or check me and we'll organize the suit. All right, man. You enjoy the rest of the day.
Dr. Batson, we also have another question that if feeling dizzy and a shortness of breath is a sign of going through menopause.
Yes, it is. Simply because, as I said, one of the issues that you can have is dizziness, lightheadedness, which is usually an indication of lack of blood flow to the brain. Now, that could be a symptomology associated with menopause. Nausea, as I mentioned as well. So yes, those can be issues associated with menopause. What you need to do is just basically look at it. But once you know you're going through menopause, and this is what I want the audience to understand. I come from old school. I was fortunate to be raised by very old people. So, the old people have a saying, an ounce of prevention is better than a pound of cure. And I believe that as it relates to everything in life, but especially as it relates to your body and your health and that type of thing, because nothing happens overnight. I mean, menopause is a transition that all women have to go through. In some cases, some women are very unfortunate where they have to surgically remove, well, they don't necessarily have to. The surgical removal of their uterus and their ovaries in some cases is recommended, which is medically known as a hysterectomy. I am not one of the biggest fans of that. I really is a procedure I do not like. I think I tell persons it should be strictly emergency that you end up in that situation, but you should not have fibroids or have polycystic ovarian syndrome and you go to a gynecologist and they tell you, well, You already made children, so you need to take out your womb. That is madness. Every part of your body is connected, and every part of your body has a function. And the thing is, when women have to do hysterectomies, they can actually end up going through menopause immediately. The thing is, usually that menopause is not a good journey. It's usually very tumultuous. It's very harsh in terms of mental health. A lot of women end up, apart from things like vaginal dryness and all those type of things, you're not feeling for people. You have, I've known of marriages that have broken up as a result of that. So, what men need to do, men need to be a little more conscious where certain things are concerned regarding their partners, wives, whatever the case may be. Because a lot of times women may, be feeling a particular way, behave in a particular way, and it is not entirely their fault. There are some hormonal changes that needs to be taken into consideration, rather. And once you know what to do, then you're able to correct the situation. And as I said at Batson Associates, I'm not necessarily a product or a one product person where I'll just recommend a product for somebody off the bat. I always believe that there should be some sort of protocol or some regime that is put in place, because consistency always gives you what you want in anything. So it's a matter of consistently following a protocol, and of course always taking diet and exercise into consideration. If it is you're not taking those two things into consideration and you want to be healthy, you're fooling yourself. They have to be some sort of mix with those in order to achieve health, even when you're looking at things like menopause. Because, so if you know anyone who's suffering, because believe me, there are a lot of women suffering silently where this is concerned, and they don't know what to do. And a lot of times when they go to medical professionals, they just give them, sleeping tablets, your regular things like your Zoloft, your amitriptyline, sedatives, and that's something maybe temporarily to help you, but long term, that is not something that you want to be dependent on.
Batson and Associates operates from 4 different locations, Chaguanas being the head office, Davie, St. James, and Tobago. The company provides services such as live nutritional blood cell analysis testing, critical body function analysis testing, and foot spa detox. We have a few more minutes here with Dr. Batson. If you would like to ask him a question, you can do so by calling 627-3223, 627-3223, or 625-2257, 625-2257. You can also send a WhatsApp to the number 306-1065, 306-1065. Dr. Batson, we have a caller. Hello and welcome to Freedom.
Yes, good afternoon, dear.
Good afternoon.
Could I speak to Mr. Batson?
Yes, sir, speaking.
Yes, dear. I try to get you so long, but I come to the office and I always get my eye drops.
Yes, sir.
And use that eye drops. But I understand now that you have something concerned for sleeping.
Yes, sir.
I have a lot of problem getting to sleep.
Oh, okay. Well, you could listen off the air, and I'll just tell you what it is and just explain it quickly for you. Okay?
Yes, I no problem, but when could I come? I would need a date or some appointment to come and
Mature cataracts are usually cataracts, of course, they mature, they're older, they are much longer. So those tend to be a little more difficult to deal with. So what I found is that the eye optics formula was helping a lot of people with things like retinal detachment. So people with diabetes, people with things like retinitis pigmentosa, macular degeneration, those type of things. But as regards to the bad cataracts or the mature cataracts, there was a new eye drop that we brought in like about 6 months ago. And what that eye drop does, it actually deals with the mature bad cataracts. So because a lot of persons didn't understand that it depends, because sometimes you would go to the ophthalmologist, they would do their test, and they would say, well, we see a cataract here, but the cataract is very small. So as a result of that, they wouldn't do surgery on a very small cataract. It doesn't make any sense because they don't clean cataracts again. What they actually do now is lens replacement, right? But with the mature cataracts, that is the other eye drop. It's an eye drop called Sincera, which we should have in stock. I know we get it next week, please God, but that is what we had. I had to bring in that together with one called MSM and use those simultaneously for the mature cataract. So it depends on the eye problems that you have, because, for example, if you're dealing with glaucoma, which is high ocular pressure, which is either open-angled or close-angled glaucoma, then in that case, the eye optics formula would be the one that you need to use. So if it is you need to get an appointment, keep in mind, we do have the additional consultants that work with me, Ms. Karishma Ramdan, Mr. Paul Green, Mr. Rene Bastamante, and myself, but you could also get additional information as regards to that. To make the appointment, you could always give us a call on 222-8261. That's 222-8261, as well as 223-7515. That's 223-7515. That's for the DB office. I have to familiarize myself with these numbers. Okay.
Dr. Batson, we have a WhatsApp message that is asking if you have a treatment for herpes.
Yes, we do. We do. So again, they could always call. You don't necessarily need to tell them what it is. Of course, your information will remain private, but definitely that's something that we can address, especially when you're dealing with immunity and viral load and those particular type of things. So one of the questions as well too, someone is asking, okay, as regards to the eye drop. So yes, once you call the number, the office would be able to give you information. And we do have eye drops in all the offices. There you go as well. Okay, so.
And I believe we can squeeze in probably one more WhatsApp. Someone is saying that they are 63 years old, and when they wake up, their left knee was swollen. They went to the doctor and was told that it was gout. They want to know what they can use to treat that.
Yeah, okay, gout. Gout is excess uric acid that actually settles in the joints. So if you actually see it under a CT scan, it would actually look like fine needles in there. So if you have gout, you need to make some dietary changes. If it is you are a red meat consumer, well, then you need to reduce your red meat intake. However, I have known vegetarians can actually get gout as well. So it's a matter of actually reducing that inflammation in the body. One of the things that you could use, there's a premium alkagen water that we carry. That's one of the things that will help in removing or reducing acidity in the body. Santulan is also something you could pay attention to. That's a 7-channel detox, which cleans and detoxifies kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs. So they can actually call and get some information with that, or call and get an appointment. Is expensive. Try ignorance. Thank you very much, and you enjoy the rest of your afternoon.
Same to you, Dr. Batson. That was our special health segment featuring Dr. Jason Batson of Batson and Associates. Visit them today on the first floor Money Talks building, 182 Southern Main Road, Montrose.
Yes, Facebook family, Instagram. Oh, you fixed it. Okay. All right. So Facebook, we apologize. You don't know what happened there. You know, when you're dealing with multiple phones, I don't know what Shakil is doing. If it was I alone here, they wouldn't have been hearing anything. They might not even seen me. So thanks to Shakil, as usual, always doing a good job. So the information is there. Keep in mind, we have that special on our Nerve Restore, that product that helps so much with sleep, anxiety, depression, those type of things. You could get some information on that. Always a pleasant good afternoon to our Instagram followers. You can like us, sorry. What does it have to say, Shakil? Like and share?
Like us, share us, leave a comment about your reviews.
Okay, so like us, share us, and leave a comment about your reviews. Those of you who have used products from Batson Associates, and the product work for you, leave a little comment there. At least let people know that we know what we're doing. Okay. The next time I'll speak to you guys is Sunday, please God. We should have a 2-hour program on Sunday. And of course, I have a makeup, something that I need to do for you guys, but I'll let you know what it is. I do apologize on Facebook for the little bit of time that you guys weren't hearing anything. All right. And look forward to speaking to you guys on Sunday, please God. Check out our Facebook. Check out that information that we have on Nerve Restore. Nerve Restore is actually going on a special for this month. So that's something you could check out. And feel free to give us a call or visit. We do have our road delivery available. Those numbers again, 222-8261. That's 222-8261, as well as 314-9975. And the number for daily number is 223-7515. Those locations, we are located on the first floor of Money Talks building. That is Money Talks building in Montrose, Chaguanas. We're also on the corner of Ramsey Trace and the SS Erie Main Road in Davie, Red Edge Mall, Western Main Road, St. James, and the Triangle Building in Scarborough, Tobago. Take care and enjoy the rest of your day. As we always say at Batson and Associates, if you think health is expensive, try sickness. If you think education is expensive, try ignorance. God bless and be safe. Enjoy the rest of your day.